Hi everyone. So the last time I talked to you about the self-quarantine or shutdown or highest alerts lockdown sort of situation that we're having here in South Korea, that was on the 2nd of March, and we're on the 14th day of quarantine. The 2nd of March was the 8th day of self-quarantine. So this is not like a government forced shutdown for most of us, but there are parts of the government that have shut down, and it's definitely advised that you self-quarantine, and there are also some buildings that are on a strict lockdown. So that's kind of what I wanted to keep you guys informed about. I know there's a lot of conspiracy theories and stuff going on, and if you guys want to make a conspiracy theory about my hair, that's totally fine. It's 14 days. Don't really care what I'm looking like. There's no makeup going on, except I did fill in my brows a little bit earlier. I wanted to do some kind of 80s makeup thing and then just gave up. And the hair is just, it's drying, so I let my hair air dry. I'm part of the very curly, frizzy hair team, so I can't blow dry it. Anyway, I wanted to just kind of keep you guys informed about what's been going on. So I'm going to be reading from my phone. That's the place where I've been taking notes. Sorry about that. Taking notes and just basically want to keep you guys sort of informed with what's happening. So the day that I had uploaded the video, the last video was the 2nd of March. And so the end of the day is when I make all of these updates to just this log that I'm keeping basically. So for day 8, that would be that day, we ended up with 26 people that had died and 4,312 people were infected by the end of the day. A lot of countries, about 40% of the world's countries, have put some kind of travel restriction on Korea, which of course has changed. But one of the interesting things that I had written down that day was that 4 of the deaths were people that were waiting to get treatment. They were confirmed cases that were waiting for the hospital. So that ended up changing the way that we were approaching this situation. So I should let you guys know that South Korea, like most developed nations in the world, we have national health care here. So one of the nice things is that if you're sick, you get treatment. And one of the approaches that Korea has had for this is that if you are sick, then you can get treatment. If you are sick and poor, the treatment is free. If you're sick and not poor, the treatment's very, very, very cheap anyway. And even if you're just visiting, if you're a foreigner that's just visiting, just on some kind of tourism vacation, and you happen to get sick, you can actually get treatment for free as well. So that's kind of helpful. The problem is that I guess they didn't anticipate the amount of people that needed to be treated. So from that day, because 4 of the deaths were from people that were waiting to get treated, confirmed cases waiting to get treated, what they ended up doing was changing that approach. So if you were confirmed with SARS-2, which is what I'm calling it, but it's COVID-19. If you were infected with that and you are in serious condition, then of course you're going to a hospital. If you're infected with that and you're in moderate kind of condition, then you go to a care facility. And if you're infected with it but you otherwise don't really have any big symptoms or anything, then you can kind of self-quarantine. So that's the hope anyway. The Ministry of Education on that day had also extended the existing 2 weeks by another 2 weeks. So it had been a week into the 2-week shutdown for schools. So they extended it by another 2 weeks. So a total of 3 weeks. The Ministry of Education has shut down schooling. So that is super exciting. All of us are still just working from home. So that's cool. If you have a job that you can't do from home, of course, go out and do your job. But otherwise, even though the schools are shut down, we're still actually doing work. So that's always excited. This is the day that people had started to really line up for masks, and that sort of develops later on, which I will talk about as I talk about the following days. Also on this day, they had deployed 1,000 additional medical military staff to help out with civilians. So that's exciting. The next day, day 9, which would be March 3rd, the death rate went up to 31. that had died, and the infection rate went up to 5,186, and Japan was thinking about maybe pushing back the Summer Olympics. Just not really sure what Japan is going to do with that. So that is exciting. The day after, we went up to, what was it, 31 dead, and then now we're at 35 dead on day 10, which would be March 4th. So that's exciting. 5,621 people were infected. Now on this day, the government had announced that they had hoped the cases would stop jumping up because the Shincheonji cult was mostly done being tested. For those of you guys that don't know and didn't see the previous video, the reason behind this huge outbreak that we've been having in Korea is because of a religious cult. They believe that their leader is the second coming of Jesus, so they just do a lot of faith healing stuff. One of their members got sick, spread it to everybody, and they spread it to everybody else. So that's been really exciting. So they have been testing the cult members, as many of them as they can find. Been doing about 10,000 tests a day of cult members and other people as well. So on this day, they said, well, you know, they're mostly finished being tested. For the cult members are finished being tested, and part of the reason they believed that the infection rates had been jumping up so much every day is because of the cult members. But then we find out later on that didn't really happen. So we're still jumping up in cases, and I'll just kind of talk about that as well. At that time, 65% of the cases were community-based transmission, so people caught it from other people, and the government was just saying, you know, distance from, you know, have social distancing, practice good hygiene, hand washing, don't touch stuff, don't touch your face, you know, if you guys are going out, don't touch your face while you're out. That's a big thing to remember if you are worried about contracting the virus. So if you are out and you have like an itch to scratch or something, maybe scratch with like the back of your arm or, you know, on your elbow or something like that, to reduce the risk. Because if somebody sneezes into their hand, touches a doorknob, you touch that doorknob, and then you come and scratch your nose, you can end up catching whatever they had. Not great. On this day, about 95 countries were restricting entrance for South Korea, 40 of which were doing an outright ban. So that was exciting. Quite frankly, I think they should. I think that vacations should be halted right now. I really do. The reason that we have so many cases of the outbreak is because we're testing so many people. So to everybody else, it seems like Korea is this hotspot, but I wonder how many other places are actually hotspots, but nobody's being tested properly. So that's why I think, yeah, it's great to block or restrict Korean travel, but maybe you should do it for everybody else too. So that's just my feeling on the matter. But on this day, the FDA here was trying to boost manpower to manufacture and distribute masks, and that kind of changes as the days go on, which I'll touch on in a bit. Also, the International Monetary Fund, I believe, the IMF, they say that they are going to anticipate global economy is going to not grow as much this year as it did in 2019. On the next day, which would be day 11, I lost count of which day this would be. I think the 5th of March, I think that we're at. We jump up another about 500 cases. So the previous day when they had stopped testing the Shincheonji members, we were at 5,621 that were infected, and then the next day we're at 6,088 that were infected. 42 had died. One interesting thing was Kim Jong-un, the leader of North Korea, sent a letter of support to President Moon, the leader of South Korea, so that was kind of nice. Also, a lot of companies are doing video conferencing. So places like Samsung, for example, they're doing video conferencing just to make sure that they can still attend meetings around the world. It kind of made me wonder, though, why don't people do this normally? It saves a lot of money and, you know, emissions and time. It just seems kind of weird. At this time, too, on this day, Japan had decided to ban or restrict travel, deny visas to Korean citizens. and the government of South Korea had asked Japan's ambassador, one of the people, to come by and try to talk about that, which didn't turn out very well, which leads us to day 12. We jump up another almost exactly 500. So we went from 6,088 infected the previous day to day 12 is 6,583 infected. 44 have died, which officially surpasses the MERS deaths. We had an outbreak of MERS in 2015, and so now we have surpassed the deaths from MERS, which is exciting. So Japan basically says no, they're going to continue the travel restrictions on Koreans, and so Korea said, well, if you're going to do that to us, then we're going to do that to you, and put restrictions on Japan, which pretty much led everybody, even the WHO, the following day, which is yesterday, to say basically, you guys are, kind of being ridiculous. This isn't like an attack against Korea. This is just everybody's having a hard time, and there's no reason to get all petty about it. So the mask sales have really changed a bit. So starting on this day, the mask sales have been really limited to ensure that there's an even distribution. There's basically, you can buy 2 masks a week, and to buy a mask, you have to present your some kind of ID number. So it could be your passport, it could be your citizen ID, it could be your alien registration ID. For foreign travelers, I'm not sure what it is. I'm sure it's probably just a passport and like a home country ID or something, but you get put into a system, and then that way you can't keep purchasing from one place and then purchasing it from another place. The big fear is that not only will there not be enough masks to distribute, but at the same time that someone might buy up a bunch of masks and then sell them to people for a higher amount of money, which would of course not be very fair at all. So the people that are not having to go buy a mask, so somebody else can buy it on their behalf, are the elderly, the disabled, and very young children. So if like I had a disabled mom, I could go and buy 4 masks, 2 for me and 2 for her. I just have to provide some kind of proof, and then I can do that. There's also an app that the president has asked the government to create. It's basically an app that shows the amount of masks that are available at each different location, so that way you don't have to go wait in line and find out that there's not enough masks. So that's I thought that was really a cool idea. The government also has allowed mask reuse for low-risk persons to sort of deal with that that whole situation. So the masks that you really want to get for this type of disease are the N95 masks. And so for those, if you're at low risk and you kind of disinfect it, they didn't give any specification for how to do that, run it through the dishwasher or something. But they basically said, you can conserve masks by reusing them, and that's that. If you are sick, then please use a new mask each time. But for everybody else, it's not too big of a deal right now. Some protection is better than no protection, is basically the idea. On this day too, Daegu, which is the hardest hit city because of the Shincheonji cult, the outbreak happened in the city of Daegu, and the cult had offered a donation to the city for about 10 million US dollars would be the equivalent amount of money. And the mayor of Daegu said, no, just like show up and quarantine yourselves and get tested. Not everyone in the Shincheonji cult is tracked down. A lot of people went into hiding. They consider themselves to be persecuted and all this other stuff, which of course, Christian persecution complex, it exists everywhere. But they basically have been hiding and don't want to reveal where they are. So that's been a problem, of course, for trying to track them down, because if they're, spreading the virus, that sucks, and we can't, even test them. The other thing too is that the people that have been tested that are on self-quarantine are not self-quarantining. So that's why the mayor of Daegu was just like, we don't want your money, we just want you to comply with just really basic public health stuff that we're asking to not spread this damn virus. So I think that maybe was a good move. on the part of the mayor. So the following day, which was yesterday, 7th of March, brought us up to 7,041 infected. So we're up another 500 people that are infected, and 49 dead. As of the making of this video, we're at 50 right now. That's the 14th day of highest alerts, but this is the 13th day I'm reporting for right now. So one of the apartment complexes in Daegu that has a person that definitely has COVID-19, or what I just nicknamed SARS-2, they've been on a cohort quarantine. It means the entire building, they're not allowed out, and people aren't allowed to visit. They're, of course, you know, able to get medical care and food and all of that. Wi-Fi is everywhere, of course, but they just have to wait. So this has been kind of going on in some different places. There was a university group or dormitory, the same thing happened with them. Somebody had tested positive for that. There was a government building where somebody's mom had tested positive, and they ended up shutting down one of the floors in the building, and then you can't come back to work until you can prove that you don't have the virus. So that's what they've been doing for places that definitely test positive for it. So that's exciting. 103 countries have restricted or banned travel from Korea. That was up from 95. So that's where we are. We're on day 14 now, like I said, and the only real difference that I can report is that we've had another death. So that's that. I just kind of wanted to touch on some of the conspiracy theory stuff. Please don't spread conspiracy theories. This is a hard enough thing to deal with as it is, and the easiest way to deal with it is just to practice basic hygiene and don't go around a lot of people. That's it. That's really all you have to do. And some people are saying, you know what, who cares, because this virus is only gonna, you know, affect old people. I mean, I'm not okay with that. I'm not okay with saying, well, you know, I'm gonna be okay, so I don't care that I'm gonna, you know, possibly kill old people. That doesn't sit well with me. I encounter old people, you know, while I'm out. There's, of course, if I catch the virus and I'm talking to my coworker goes to talk to her, you know, her mother-in-law or something, her mother-in-law can get it. Or, you know, if you talk to a pregnant person, we don't really know how that kind of works out, but we know that, you know, if you're pregnant, it's really difficult to just treat illnesses anyway without harming the fetus. And so it's not something that I'm comfortable with, and I'm just really shocked that I'm seeing a lot of people saying, who really cares, the only people dying are old anyway, or old or sick, you know. Basically, fuck everybody else. I'm basically healthy. That's what a horrible approach to have to this, you know. It's just because you're sick or old doesn't mean that you are, you know, not a valuable member of society, that you're not contributing to society, that you're not improving somebody's life in some way. You know, that's such a disgusting attitude to have, and I'm really shocked that I've seen that multiple times. Even from older people, you know, it's like, oh, somebody died that's 75 years old, but I'm 65, so fuck that. I'm not going to follow what this government thing says. It's just a big conspiracy. I've met people that talk like that. I know people that talk like that. They're part of my family. To basically say, I'm not that old, so who cares? It's been really troublesome. I'm also really worried about the U.S. Really worried about the U.S. right now, because I think, you know, a lot of countries are going to have the same problem as the U.S., which is they're not testing everybody. So it's going to be pretty difficult to actually assess how many people have been diagnosed. But I think with the U.S., there's a few things that make it worse. Number one, lack of national health care. So if you get sick, that's kind of too bad. The other issue is that a lot of people can't take time off of work. There's no designated sick days. The U.S. doesn't have really any laws to protect worker rights and worker sick days. Most of the other countries do. So a lot of people here, when they get sick, they just use their sick days, and then they also use the national healthcare system. And it's not like we're in poverty over here. It's not bankrupting me to have some of my tax dollars go to that, you know. So it's not. I was always told that it's going to be way too expensive, and that, you know, national healthcare just doesn't work and all this other stuff. Living in Korea, it's totally works. You know, it's not very expensive at all. You know, when I was in the States, you know, my family paid way more for medical insurance every month than I pay out of my paycheck every month. So it's much cheaper. So that's it's been an interesting sort of situation. If you guys want to talk about that, you know, feel free to ask questions and stuff in the comments section. You know, keep it civil, but just, you know, ask about it. The other issue is that unlike a place like the UK, there's a lot of state rights, and that's great. The US is super big, and, you know, states should be able to figure out individual stuff that works for them. You know, if you're living in Arizona, you probably don't need a blizzard preparedness plan like you would if you lived in Wisconsin or Michigan. Sure. But in this case, there's almost like a fear of the federal government and a fear of medical things that the government wants to do, because a lot of the US is heavily Christian, including a type of evangelical Christian that's basically waiting for the end times to show up. And so anybody that's going to require any kind of mandatory health, anything, mandatory vaccine or anything like that, I know a lot of churches try to scare people by saying they're going to take away our religious rights, or they're taking away our freedom of choice, that sort of thing. So even if they want to get that treatment, they're going to refuse it on that twisted principle that it's going to hurt their religious views or freedoms somehow, and that's just not the case. You know, that's great that you think you're going to heaven, but maybe care about the people around you in this life a little bit. So that's kind of what I got to say about that. If you guys see any stuff online that just seems like absolute crap in terms of recommending like cures, you know, essential oils and stuff, please report it to the administrators, you know, like you know, report it on YouTube, report it on Instagram. If it's in a forum, if it's on Discord, you know, report it to somebody who's like an admin on the Discord channel or something like that, or the Discord server. You know, please try to limit that. And I know there's a lot of confusion right now. If you guys have questions about it, if you have questions about how to, you know, just some basic stuff that you need to do, how worried you should be, that sort of thing, then please feel free to talk about it, ask about it, post about it in the comment section, please. You guys can come to my Discord server. That's going to be linked in the detail section below as well. And, you know, Patreon's there too, but I feel like that's not, I don't know. I feel like this is more like a public service thing, so Patreon's not really the thing I want to promote right now, but it's there. But yeah, it's, you know, overall things have been good for me. You know, I'm getting work done, and you know, as much as I'm not caring too much about you know, my personal appearance here, you know, I am very good in terms of mental health. You know, I'm taking care of my hobbies and everything, and you know, just having a time, sane time. So that's my hope for everyone. And in the previous video, I kind of laid out how to do that so you can prevent cabin fever. So that way I don't have to hope, I can help. So that's the goal anyway. If you guys have any questions, comments, whatever you have, please feel free to post it in the comment section or check out the Discord server. But, you know, stay safe, stay indoors, and seek medical treatment if you need to. Alright guys, bye-bye.